So signs and symptoms of strangulation, what we've noticed is this varies a lot. Some people will come in and they will have no obvious signs. About 50% will have no obvious signs. If you go into the history with them, then what we're finding is quite a lot of them are saying that they had a real fear that they were going to die during this assault. And when you think about that, that's quite obvious. Somebody's got their hands around the neck, so it's usually hands, stopping them from breathing, and there's an overwhelming fear. If they have lack of oxygen going up to the brain, then one of the issues they might have is lack of memory. So the part of the brain that is involved with memory is very sensitive to any drops in oxygen. So what you might have there is somebody who presents as quite confused. They might not even be clear about whether they have been strangled. So that can make it difficult for anybody investigating the case. They'll complain of neck soreness. One of the symptoms they might have is a croakiness in the voice, or that the voice has gone deeper for a day or two. They may have bruising on the face, they may have bruising in their eyes, they may have problems swallowing, so it might be painful for them to swallow, it might be painful for them to breathe. But as I said before, 50% will have no injury, and if you speak to the pathologist, they'll have people who are dead with no external sign of strangulation. So I suppose an important thing is if somebody gives a history of strangulation but they have no external sign of it, it doesn't mean that it didn't happen.